So I just wanted to update you guys on a lot of things. So many things at this point. So tomorrow I'll be 36 weeks. So I'll be 9 months pregnant tomorrow. And you would assume that I'd have a month left, at least, maybe even 5 weeks. Because I am a first-time mom, and first-time moms usually go over 40 weeks, unless they opt to be induced at like 39 or so. Well, my situation is a little different. I am getting induced in 8 days. So when I turn 37 weeks, I am going in to be induced. Normally, this is not like standard procedure just to induce. Like, they don't induce people just at 37 weeks for no reason. I developed hypertension about halfway through the pregnancy, somewhere between like 16 and 20 weeks ish. Before then, I have never had high blood pressure pre-pregnancy, and even in the first trimester, I didn't have high blood pressure. So I don't know what happened, what changed. It's pregnancy-induced hypertension, or gestational hypertension. So with that being said, I started taking meds around 20-something weeks to control the blood pressure, and it definitely has helped. Thank God. My blood pressure was at one point pretty concerning. It was like 140s over 90s, and now this phone is really not gonna cooperate at all. I need a dash thing, but now it's in the normally 120s over 80s. Sometimes I can get in the 130s, but just depends. But it's pretty controlled with meds. The issue is, thankfully I don't have any preeclampsia symptoms or like signs except for the blood pressure. I haven't had protein in my urine. I haven't had like any extra swelling or anything crazy like that. So that's been great. But my doctor is concerned that once I go into labor, there's so much going on in your body, so much pressure and stress and all these things, that she is scared that, she didn't use the word scared, but she just said she believes that my blood pressure will skyrocket, and that can cause issues during labor. So, and obviously the longer I go in pregnancy, the higher my blood pressure can get, because even though it's still in the 120s over 80s, most of the time it has slowly increased like every week, just by a few numbers. It's still pretty normal. But anyway, on top of that, I am obese. Like, that's just what it is. And she's never brought up my weight or anything like that. And really, even when we talked about it, she didn't talk about like obesity, but for like not even a second. Like, she just said that's a factor. So there's just a lot of factors that go into it, and it's safer at this point to induce me at 37 weeks than to go full term, so they can monitor me. And I was trying to push for 38 weeks, and they're not going for it. And I was very in shock. I found this out like a week and a half ago, and when I found out, I literally cried. I had like a full-on panic attack in my doctor's office, because she hadn't mentioned it, like, even though we've known about my blood pressure problems for like 4 or 5 months, it was never mentioned that I was gonna A, be induced, and B, be induced at 37 weeks. Which thankfully 37 weeks is not too early. It's not like it's like 34, 35, like that's, we're closer to the end. But still, I thought I had, at this point, she told me, I think when I was like 34 weeks. So I thought I had like 6 weeks left, in pregnancy. At least. I was thinking probably even like 7, because I thought I'd go to 41 weeks. Because that's pretty average for a first-time mom. Well, I found out instead of having 6 weeks, I had like 2.5, yeah, something like that, 2.5, 3 weeks. So it was just a big shock to me, and me and my husband have so much to do. And so today so something I've been doing since 32 weeks, and again, I feel like she should have mentioned the induction when she mentioned this, but I don't know, whatever. Starting at like 32 weeks, I started going to my appointments every single week, and then drinking Sprite, by the way. every single week. I get an ultrasound every single week. Well, they call it a biophysical profile. So that's actually like, it's an ultrasound, but it's a specific type of ultrasound where they like check fluid, check to make sure he's practicing his breathing, and some other stuff. And then I go twice a week to the hospital, which is next door, thankfully. And I get these things called NSTs. Those are called non-stress tests. And I just monitor the baby's heartbeat and if I'm having any contractions and stuff like that. So, because I'm getting induced in 8 days, even though he'll be technically full term at 37, we want to boost his lung maturity. So, they gave me a steroid shot today in the butt. And they told me it was going to burn. It did not burn. But maybe because I'm so fat, like, my butt just, it didn't sting because I got, like, that layer of protection. It is a little sore right now, but it really doesn't bother me. And then I have to go back tomorrow and get another steroid shot. And that should help, you know, give him just a better chance. Like, I mean, his chance of survival is extremely high. I'm not concerned about that whatsoever. But obviously, the last things to fully mature in a baby is their lungs. So we want to give him that little boost. So when he comes out, you know, he'll have a easier time, I guess, whatever. So that's what's going on. Then the thing that, like I said, I was stressed out, not only because I thought, I mean, at this point I'm fine, like, I've accepted it, it is what it is, like, there's literally, we're going in next Friday to have a baby, like, that's just what it is. But we had so much to do around the house, and I mean, we just had a lot to do. Like, his room wasn't done, we had things to fix up. And I know, like, some of that stuff doesn't seem important, like having his room done is not, like, the baby doesn't care, but I cared because my house is very, very tiny. Like, I live in a single wide trailer and it's just so small. And so I have to be organized or else it gets to be chaotic. And we have so much baby stuff. We had my baby shower. Thankfully, I had my baby shower like a few days before I found out I was being induced. So I'm glad that I was still able to have my shower. And we got so much stuff and we're super grateful. And I was planning on doing a baby shower haul video, but we had a rush to get his room done and I had to start organizing stuff for like my mental health. So I might do a nursery tour, but I definitely couldn't do a baby shower haul. So anyway, but yeah, for me, I need things to be a little organized. I need to know where things are, like, you know, so it was really important to both of us, my husband and I, that we got his room done. And so it's basically done, like all the big stuff's done. We just have, like, it's painted, his crib's put up, his changing table is in there. We have all that stuff done. I just have to wash his clothes, wash all his blankets, just like wash everything, disinfect everything, and all that stuff. And I'm probably going to do that. I'm probably going to start on that today so I can just go ahead and get it done. So his room's kind of messy with just stuff everywhere, but like it's done, if that makes sense. It's just I gotta get to the organization part and like cleaning now. And then there's stuff we got to do around the house. So originally, let me tell you guys my original like plan. And obviously plans are just plans. That's exactly what they are. They're not guaranteed that things are going to go out that way. But it's just funny, you know, like you have all these things that you expect that are going to happen. And of course, babies are unpredictable and pregnancy is unpredictable and things don't always go the way you want them to, but there's just things I wasn't expecting, right? So originally I was thinking, okay, I want to have everything done by the beginning of September, which even if I wasn't getting induced, still wasn't going to happen because it's like September 9th, I think, today, and we still don't have everything done that we want to because there's other stuff in the house that we want to like fix and whatnot. But that was my plan, was to have everything done by September. Anyway, we wanted to have, I'll fix it in a second. We wanted to have everything done by September so that way I was due October, well, I'm still due technically October 9th. So that way I could have like a month or so to just kind of like relax and like me and my husband just spend time together and not stress out and really just chill. On top of that, my birth plan, which I was going into things like knowing like stuff can change regardless of my birth. I still have a birth plan technically, but I know things don't always work out the way you want them to. So I went into it knowing things could be different, and I'm okay with that. But my original like plan was to not be induced, minimal interventions as far as like, you know, what they're going to do now, most likely, depending on how my blood pressure looks when I go in. She said I'll probably be put on a magnesium drip, which is not fun. It burns, I hear, and makes you very groggy and like just you know, I use magnesium to help me go to sleep at night. So makes you very tired. I will probably have to be put on IV medication for blood pressure. I'm gonna be induced, so that requires a lot of times Pitocin. I mean, I might have different options, and I'll have to ask at my next doctor's appointment on Monday. I see my doctor on Monday, and I'm gonna ask her all that. But you know, I didn't want Pitocin if I didn't have to, and I didn't want to be artificially or not artificially induced, but like just induced period if I didn't have to. I know most first time moms do end up getting induced anyway, but like I just wanted to avoid it if I could. And I mean, just those kind of things. Like I just wanted to have as natural labor as possible. And I know I'm still being optimistic, but I'm also being realistic. I know that inductions are very painful because it's forced contractions. It is artificial contractions, basically. They're artificially induced contractions from the Pitocin and stuff like that. So I always hear it's a lot more painful. And I didn't want an epidural. But again, I'm going into it like if I get an epidural or something, like it's okay, but I would like to avoid it if possible. So we're just gonna see. We're gonna see how things go. I know at the end of the day, whatever I have to do to get my baby out. Like another thing, I didn't want a C-section. They're not talking about C-section at this moment in time, but I just got really, really nervous that C-section is like, I don't know. Not that it's going to happen. I get very, very anxious thinking about if I have to get one, because like sometimes inductions fail or your body's not progressing or all these different things. You know, there's so many scenarios, and I do try to be optimistic. I really do. And I know I don't sound optimistic at all right now. It's just that I am trying to go through the scenarios and just like try to mentally prepare myself if any of these things happen, because I did not mentally prepare to be induced at 37 weeks prior. Like I had no mental preparation for that. So for the rest of these things, like I want to kind of be like, okay, if this happens, like it'll be okay, it's gonna work out, whatever. So anyway, at the end of the day, I'm gonna do whatever I have to do to make sure my baby is safe and have him here and that I'm safe, obviously. But anyway, so that's like the gist of everything that's going on. It's just kind of crazy because it sounds so stupid, right? But you know, like when you get pregnant and you're having this baby, and as the pregnancy goes on, like you know you're gonna have to give birth. Like duh. I mean, hello. I know I'm gonna have to, whether he comes out C-section or vaginally, it doesn't matter. Whether or not, I'm gonna have to give birth, okay, right? And I know this. I've known this. But until you get to like the end where it's like, okay, I really am gonna have to do this. Like, I don't know why, it just feels different. It's like I'm really going to have to give birth next week. Like I'm going to have to. There's no way around doing that. Like it's just, I don't know. It sounds so silly when you say it out loud, but like in my head, I'm just thinking, like I'm about to be a whole mom. I mean, I technically am a mom. I do consider, if you are pregnant or if you have had a child or been pregnant, whatever, like you are a parent for sure. But I'm about to have to take care of a whole human being. Like I am about to meet my child, and I'm gonna get emotional. Like I was telling my husband last night, I was like, it's so crazy. I know this is like on another topic, but like me and him, this man that I love, I have been with my husband almost 7.5 years. Next month will be 7.5 years that we've been together. And also it's our 4-year wedding anniversary. And it's like this person that I've spent so much time with, and I've just waited, you know, what feels like forever to have this child with him. Like, it's finally here, and like, I haven't even seen him, the baby yet, right? But just knowing that we created this human being, this tiny little human being, and we did it together. It's just like, this baby is half of me and half of him. Like, it really is a miracle. I know some people don't see like pregnancy and childbirth and all these things as like these insane miracles from God. They just are like, ugh, it's just science. No, it is such a miracle. Like, I look back at his little, I'm sure I'm going to do this when he's here too and be like, whoa, this is crazy. But I look back at his ultrasounds from like 8 weeks or even 12 weeks, and I'm like, he went from, and even before then, you know, when they're conceived, they're the size of a cell, which is microscopic. And I'm like, you literally went from this tiny, like 1 centimeter or whatever, like little thing. And now he's this probably like 6 or 7 pound baby. Like, how does that even happen, you know? But anyway, I'm very excited. I am nervous, but it's not like a bad nervous, like, where I'm like, I don't know how I'm gonna do this. Like, I'm so scared. I mean, I am kind of scared, but like I said, it's not like a bad thing. It's like a good type of nervous, a good type of scared, where it's like, I don't know how to explain it. I hope it just makes sense when I say that. Like, I'm very excited, scared, excited, nervous. Like, oh my gosh, this is really happening. I never thought this day would come. You know, I feel like my pregnancy has went by really, really fast. And I know pregnancy has gotten really, really hard at the end. I mean, there's been like little bumps in the road where it got hard. It would be hard for like a few weeks at a time, and then it would be smooth sailing for a while. Overall, my pregnancy has been good though. Like, I really can't complain overall. But the last, I don't know, 2 weeks have been rough. And I think that's what's helped me kind of accept that I'm getting induced as well. Because if they weren't inducing me at 37 weeks, I wouldn't try to be induced earlier just because of the pain I'm in or anything. But knowing that I am going to be induced and I am in a lot of pain, I'm like, okay, like, I can get down with this. You know what I'm saying? But even though pregnancy is like pretty hard right now, and I really am in some intense pain, like my back's killing me. I have not been diagnosed with SPD. It's like, I can't remember how to say the word correctly, but it's something with your pubic area, and it literally feels like your pubic bones are like grinding and breaking, and there's so much pressure and it just hurts. I'm pretty sure I have that. It is so painful in my pubic area. But anyway, the point being is, even though I'm going through all that, I know I'm going to miss being pregnant, and I know I'm going to miss feeling him inside of me. And that's kind of like something I think about too. Like, I am so excited to meet him. Seriously, I can't even imagine like what he looks like. I have dreams of what he's going to look like, but I don't know. He can come out looking completely different. I have dreams that he looks a lot like me, but I feel like he's going to look like my husband. But all my dreams, he looks just like me. But anyway, and so I'm excited to meet him. I'm excited to be his mom. I'm excited to breastfeed. I'm excited to snuggle him. I'm excited to change his poopy diapers. Like, I know it's not all fun and games, but I'm excited for it. But I know I'm gonna miss being pregnant, and I know I'm gonna miss feeling his kicks, and I know I'm gonna miss feeling like I can basically, like, he's inside of me, and I can basically protect him from anything. Not technically, but you know what I'm saying. Like, I just feel like he's secure, you know. But anyway, I just got home and I got stuff to do, and I'm tired, and I want to go take a nap. I take a nap every single day. I do have to, because if not, I will just, I don't know, I will be tired and groggy. And I try to like power through it some days and not let myself have a nap, but it's too hard. But So that's the gist of everything. You guys know it all. I really do want to record my labor. I don't know if I'd even post on YouTube, but I do want to record it. But with the corona stuff going on, I don't know if they would allow me to have the camera on. And I say this because, like, in my head, I'm thinking, like, if someone doesn't have their mask on properly or something, like, I'm not going to say anything, or, like, I mean, I'm probably not even going to be paying attention, but, like, they could be held liable, I'm sure, in some kind of way. If for some reason something is caught, just done wrong by just an inch, you know? So I don't know if they'll let me do that, but I really want to. As far as I know, only my husband can be in the room. He can't leave the hospital at all, unless he doesn't want to come back. So, like, if he leaves, he can't come back. So, yeah. I mean, that's going to be nice for me, but we have dogs. So, I'm going to have my mom come down and take my dogs out for, like, hopefully we're only there for, like, 2 days. They are discharging patients way faster because of COVID, which I'm totally cool with. However, inductions can take 2 or 3 days, and then you have to wait another 24 hours after the baby's born. So I'm just praying, like, if you guys pray, or y'all are, you know, you're into that, just please pray that I have a smooth and fast induction, and my birth plan can work out. If it doesn't work out, it's totally fine, but if it can work out, that'd be great. I would be so happy. And just pray that baby's okay. He's been looking great. Every test we done, every ultrasound, he looks literally perfect, which is awesome. So just pray that everything works out fine, and I'm sure it will. And I'm excited, and it's very weird to think it's not just gonna be me and my husband anymore. You know, we've been together 7.5 years. And it's always just been us. Yes, we have 2 dogs, but you know what I'm saying. And now we're about to have a child. Almost doesn't seem real. But anyway, I'm going to go ahead and end this video. I literally did this video the whole time I was driving home. So if you guys like this, if you are here to, you know, support me and subscribe and just see how things go, yeah, just go ahead and hit the subscribe button. Please like this video, and I'll try to keep you guys updated. I will try to make some more videos. I cannot guarantee anything. I know I've slacked, but it is what it is. We have a lot going on in our lives right now. So I will talk to you guys next time. Bye, y'all.